Hello, Ms. Stevens. I'd like to discuss with you now your oral health and your assessment pertaining to it. Do you mind if we take a few minutes going over that and we can address any concerns that you might have? Okay, we'll go ahead. So after my assessments, I calculated that your marginal bleeding and your bleeding upon probing were both above 60%, which is a concern. We generally like to see that below 10%, so we're going to work on getting that down. It is an indicator of early periodontitis, so that is something that we'd like to take care of as soon as possible. Also, your periodontal pockets, when I measured them, were 4 to 5 millimeters, and that is also a concern regarding periodontitis. We do see that you have some active caries, and we can refer to the dentist for those to go ahead and stop that decay before it gets any worse and end up having any root canals or crowns that need to be done. That can be addressed also. And I see that you do have type 2 diabetes. There are different concerns we have for patients that have type 2 diabetes, and that can be xerostomia, which is dry mouth. Your salivary glands aren't working properly. They aren't producing sufficient amount of saliva. Also, diabetic gingivitis, where your gums can get really irritated and red and bleeding. Also candidiasis, it's a fungal infection that can affect those with type 2 diabetes as well. And you also might have an accentuated response to plaque. And then also, as your primary care doctor might have told you, that you have delayed wound healing. So meaning that a lot of wounds that you might get, whether it be in the mouth or somewhere else, they don't heal as quickly as you would like. So I do see that it shows on here that you do suffer from depression, and that is something that I know can make it really hard for your home care. And what I'd like to do is just set up some goals with you in regards to that, and see what you're most comfortable doing, what you think is a realistic goal for accomplishing. And what I would like to see is if you are brushing twice a day for 2 minutes with just a pea-sized amount of toothpaste that I'm going to recommend. It's called Parodontax, and that will help with inhibiting bacteria, and it'll also help control bleeding that you may have when you're brushing. It'll get that under control, and also helps reduces the plaque when you're using it the twice a day. And then also, I would like you to be using the spool technique that we talked about, flossing at least once a day. If we could try and go ahead and do that. So I know this may seem like a lot of things to work on, but I just want you to look at it as just little things that you do, as long as we want to create a habit. We want to create some consistency in your toothbrushing and your flossing methods, and that way, just little by little, we can start to arrest the progression of periodontitis, and also to help you with some self-motivation as well. Now, did you have any other questions for me? No? Okay. Okay, well, thank you, and we'll see you in 3 months. If you have any other questions or think of anything, you can go ahead and call the office, and I'll be happy to help you. Thank you.